Type 2 diabetes can be reversed, says exciting new findings by medical researchers in Scotland. I'll have details in just a minute. And find out what the latest study says about coffee's health benefits. My special guest is psychologist Dr. Jennifer Weinstein. I'm Bob Garvin. Welcome to Body Talk, episode 107. If you have any questions or comments about this podcast, send an email to lifestarmedia@gmail.com or visit us on Facebook at Body Talk Bob Garvin. Type 2 diabetes can be reversed in less than a year with the help of a doctor and a weight loss plan. Newcastle professor Roy Taylor says these findings are very exciting. They could revolutionize the way type 2 diabetes is treated. This study, he says, builds on the work of the underlying causes of the condition so that we can target management effectively. These new findings found that 86% of people who lost at least 33 pounds had reversed the disease within a year. 46% of them were able to stop taking diabetes medication after following a low-calorie diet for only 3 to 5 months. This new research is part of the Diabetes Remission Clinical Trial at Newcastle University and Glasgow University in Scotland. Researchers there tracked the health outcome of 298 people diagnosed with type 2 diabetes. The findings show that the simple solution of weight loss can yield significant benefits. Taylor says this weight loss results in reduced fat inside the liver and pancreas, allowing these organs to return to normal function. Taylor went on to say, what we're seeing from this study is that losing weight isn't just linked to better management of type 2 diabetes. This weight loss can actually result in lasting remission. The study of this potential type 2 diabetes cure, it was published in the journal The Lancet. Cognitive behavior therapy, meditation, and Reiki are the topics of conversation with my special guest, Dr. Jennifer Weinstein, a licensed clinical psychologist and a certified clinical trauma professional. She practices at Cognitive Behavior Therapy Associates in Lexington, Massachusetts. Dr. Weinstein, let's begin by defining cognitive behavior therapy. Exactly what is CBT?
So cognitive behavior therapy is basically about helping people to identify thought patterns they have that are not helping them and teaching them skills to learn how to refocus onto other thoughts, as well as identifying either problematic behaviors that they're engaging in that they'd like to eliminate, and or identifying behaviors that would be helpful that they would like to implement and helping them to do that. And in doing both of those things, helping a person to feel better emotionally.
So if somebody gets involved in this, is it a long-term process? How soon can they hope to expect some results?
Assuming that the person is willing to put in the work required, usually after several sessions they can start to notice a difference. So it's, generally speaking, a shorter-term type of treatment than traditional psychotherapy.
We hear today about just substance abuse and drug addiction. Can cognitive behavior therapy help in these situations?
Yes, it can. Obviously, drug addiction is a behavior that a person ideally would be hoping to eliminate, and so CBT can help with identifying triggers to using drugs and what they can do instead to try and change their behavior.
A couple of episodes ago, we had a pain psychologist on, Dr. Beth Darnell from Stanford University, and she talked a bit about the brain and pain. If someone is suffering from pain, could this therapy help them as well?
Yes, it could. When somebody has chronic pain, that certainly can be stressful, and it certainly can influence the focus of a person's thoughts, as well as potentially their behavior. So CBT can definitely help a person to not only reduce stress, but also to shift what they're focusing on instead of the pain, and using, say, relaxation tools to help feel better.
How about anger management? Somebody who's just flying off the hook all the time, comes into work and they're always pretty tensed up and everything. Can we alter that behavior as well?
Definitely. With anger management, again, it's about helping somebody to identify what's triggering their anger, how they can, strategies they can learn to pause and be able to reduce their physiological arousal in the moment enough so that they can choose their response as opposed to simply reacting.
How about something like ADHD? Could it help with a deficit disorder?
Yes. With ADHD, there are strategies that a person can utilize to help with things like focus and organization and time management and stress management. And part of CBT, again, is learning skills. And a growing area in psychology, which works very nicely with CBT, has to do with mindfulness and meditation type techniques. And mindfulness is definitely a strategy that can help both with ADHD, anger management, as well as a lot of other issues.
Now, we hear a lot about cognitive behavior therapy, but has it been around for a long time?
It's been around since the 50s or 60s or so, and it has become a lot more popular recently because it is an evidence-based treatment for things like anxiety and depression. CBT lends itself well to research because it's a little bit more structured than other types of psychotherapy, and so that's why it is an evidence-based treatment. Some types of psychotherapy don't lend themselves as well to research, but CBT has been shown to be very effective.
When do you think someone should think about doing this? When would someone be a candidate for this therapy?
Well, if they have certain conditions like anxiety or depression, it would probably be a useful type of therapy to engage in. For other people, they may have tried other types of psychotherapy and either didn't like it or didn't find it as useful, and so this could be something new for them to try that might work better.
If somebody comes to you with depression, is CBT the type of therapy that we would be looking at, or would there be other types of treatment we'd look at for this?
CBT, again, is an evidence-based treatment for depression, so that definitely is something that can be helpful, helping somebody with identifying thought patterns that may be contributing to the depression and learning to shift that, activating them behaviorally, getting them to engage more behaviorally, socially, helping them to feel a sense of involvement or mastery over tasks to help improve mood, and medication can certainly be a part of that.
In your practice, what do you get most excited about?
I specialize in working with adults who have OCD, phobias, and other anxiety disorders. I am trained in a type of therapy called EMDR, so I do a little bit of trauma work as well. But people come to see me specifically for the treatment of OCD and anxiety, and that's something that I really do enjoy. I also enjoy blending mindfulness and meditation-based strategies into my work.
Anything going on in the field today that's kind of exciting?
Well, there's definitely always new research about the brain because I don't think we'll ever fully understand the brain. I'm excited to see what happens as far as the integration between East and West. For example, continuing to incorporate tools like meditation or even other kinds of Eastern modalities. So I do have a personal background with meditation and with Reiki, and I do use mindfulness and meditation quite a bit in my practice with great results. There's a lot of research on meditation and mindfulness as well.
Is there a simple way to get into meditation?
Of course. There are a lot of types of meditation, but basically a simple way to meditate is to focus on your breathing and to just sit with your breath and notice your breath. And whenever thoughts enter your mind, you acknowledge the thoughts, you let them go, and you return your focus to the breath. And you can sit there for 5 minutes and do that, and that's meditating.
What about Reiki now? When I look at Reiki, are you a Reiki master? Is that correct?
I am. I'm a Reiki master teacher.
Now, do you put your hands on people, or is it just the energy around people?
In traditional Reiki practice, I would put my hands on people. If I incorporate it into my practice, I don't do that. But you don't need to do hands-on in order for it to be effective.
How is it effective? Some people will look at it and they just don't believe it's possible it can work.
It basically helps to reduce sympathetic arousal, so in other words, shutting off that fight-or-flight stress response and instead activating the body's relaxation response to bring the body back into balance. So it can be very helpful for stress management, relaxation, sleep, There have even been some studies that show it's helpful for pain management.
How would that work? I mean, what's going on there? I mean, are you like a healer of some sort? Do you sort of channel energy, or do you bring up energy in other people? What's the process there?
Well, all of us have an electromagnetic field, and so it is about energy, and it basically stimulates the person's own capacity for self-healing.
So basically with Reiki, you're saying that you're really teaching a person to heal themselves.
Yes.
What is the most rewarding thing about what you do?
Well, it's certainly rewarding to see people make progress and feel better, but for me it's also an honor to be a part of somebody's journey in their growth process.
Dr. Weinstein, thank you so much for joining me today on Body Talk. Finally, is coffee really a healthy drink? Yes, claims the latest research, which shows that drinking 3 to 4 cups of coffee a day is not only safe for most people, it might actually protect against heart disease or an early death. The findings stem from a review of more than 200 previous studies. This fresh analysis also linked moderate coffee drinking to a lower risk for developing prostate, skin, and liver cancers, type 2 diabetes, liver disease, gout, gallstones, and dementia. The review suggests that drinking coffee in moderate amounts seems to reduce the risk of dying from any disease compared with those who don't drink any coffee at all. Again, the biggest benefit was linked to consuming 3 cups a day. This analysis was published in the British Medical Journal. Well, that's it for this edition of Body Talk. My producer is Katie Stell. The Body Talk theme song was composed by Rob Carlson and sung by Vicky Vox. If you'd like to stay up with medical studies on a daily basis, follow me on Twitter at BGPVideo. And if you have any questions or comments about this program, feel free to send me an email at lifestarmedia@gmail.com. Body Talk is a production of Lifestar Media.